So I'm doing L3, L4. So I have my finger right between those, okay, in the interspinous space. And so what I'm going to do is I'm going to allow you to just straighten out your bottom leg for me some. And I'm going to start to flex the hip until I just feel L4 starting to move in my left hand. And I can go past, and I just want to get to that spot where it's just starting to move, wherever that happens to be. What you want to do is kind of hook their leg. You can bend your, that's behind that there, okay? And then with my thigh, I'll kind of keep that spot. Now what I'm going to do is I'm going to switch my hands. So this hand is going to go right on that same interspinous space. And what I'm going to ask Brooke to do is just grab my elbow with your hand. Now when you pull the person, we're going to rotate them, okay? And I'm going to rotate her away. You're going to do that by grabbing the bottom arm and pull more up towards the ceiling with the arm. I already popped once when she was turning like that, right? Just until I start to feel that top vertebrae start to move. Now what I typically ask the person is to kind of just take their wrist in their own hand like that, so kind of grab all together, and my arm's going to go through. Is that okay? Is that all right? And so what you're going to ask the person to do is take a nice deep breath in, let it out. As she lets it out, I log roll her to the end range position. And when I'm in this position, now I can just drive my forearm straight down to the floor. When she's not log roll, when she's in this position, if I'm going to thrust through her hip, I have to do that this way. What we're showing you to do is do this technique where the person takes a deep breath in, out, and as they let it out, just log roll them around, take up the rest of the slack, and then just do the thrust. The idea with the lumbosacral thrust, if I'm going to perform this technique on her right hand side, okay, I want to close down all the lumbar facets on her right hand side, excuse me, right hand, right. So I'm going to want to down glide and compress the lumbar facets on her right side. So what two motions do that? What two motions are going to close down and compress her lumbar facets? Right side bending and left rotation. Maybe extension as well, right? Extension would down glide it, but we're not going to have her extend over the table, right? So we're going to take her legs and pre-side bend her lower lumbar spine over. And if when I put her down, her legs start to slide or move, you can even cross the one leg over the other. Just try to keep that there. Then I'm going to come to this. I'm going to ask her to cross her arms over her chest. And what I'm going to do is simultaneously right side bend, left rotate her at the same time. Now there's a few different ways you can do this, okay? This is not the way I do it so much anymore, but I'm going to keep my hand here, try to keep her spine in this position. I roll her so that her PSIS, her pelvis on this side, just comes off the table. The reason why I need it just off the table is I'm going to provide a PA force, and if it's up against the table, there's nowhere for that pelvis to go, right? So I have to have her pelvis on this side. You'll see it's just enough clearance there off the table. So your hand goes on the person's ASIS. You ask them to take a deep breath in, let it out. As they let it out, you just take up the slack to the ASIS and give the thrust, okay? Another thing that I've had more success with than doing it that way, again, the setup and everything's the same. I'm going to have you cross your arms. The setup's the same, but from this part, what I ask the person to do is, can you clasp your hands loosely behind your neck? And what's actually worked for me quite a bit is I'm going to let my hand come through here. Just kind of stay there like that. Take a deep breath in, let it out. I've had more success with that. It's just a different way of trying to maintain the rotated side bench position, where your hand goes through their arms. You kind of get your hand on the table at that point, or somehow stabilize it on the table, and then you just go through the ASIS for the thrust. Upper and lower thoracic. From like T1 down to T4, T5, generally, that depends on the size of your patient, your stature, but you can stand at the head of the table to perform the PA thrust, okay? The PA thrust is going to be performed. You're going to find both transverse processes that you want to perform the technique on. You're going to put your hypothenar eminence on both sides. And then the thrust technique is just them taking a deep breath in, them letting it out, and then you're just going to apply that PA force. Now be mindful of the curve of the thoracic spine, okay? So when you're in the upper thoracic spine, the direction of force is going to need to be at a downward inferior angle. So I'm not pushing straight down to the floor, but I'm pushing at a 90-degree angle to that curve of that spine. Start to get lower, I need to come to the side of the table. And then from the side, we call this like the Texas twist, right? Some people call that. So you're going to place both hypothenar eminences over the transverse processes of the one you want to perform the thrust, again, the person's going to take a deep breath in, they let it out, you take up the slack, and then at the end you're going to give the PA force. High velocity, low amplitude, so we need to see like a little bit of a quicker force. Part, especially for the Texas twist, I think for a lot of people it's about taking up the extra skin slack on the back. Like you can see there's a lot of skin motility. And if I just put my hands over the top straight when I'm going through, I could lose where I am on the back, right? Get into a position where it's almost like giving a CPR thrust, right? It's almost like giving chest compressions. You need to be nose over your hands, okay? You don't want the table high where you're off center. As far as assessment goes, if you're looking for a technique, like for me, I could always just get into the treatment position that I want to and start to feel like where that tightness is. Take a deep breath in, let it out. Deep breath in and out. I think I'm on the transverse processes of T4, and I'm pressing on both transverse processes of T4 downward. I'm given a flexion thrust for T4 on T5. But the thrust is going boom, 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 right? So that force is dissipating up and down the spine. And if you wanted to perform a rotational thrust, all you're doing now is you're offsetting your hands onto the different level of transverse processes. Right? Just like the two-finger technique. All right, except now your hypothenar eminence is on one, your hypothenar eminence is on the inferior segment or the inferior vertebrae. So when I provide the PA force, I'm getting that rotation out of the thoracic spine, right? So I'm trying to get as much of my piece of form just in one spot. No. Do that again. Let it out.
Don't you have to wait 20 minutes?
Posterior to anterior thrust technique, but instead of the person laying on their stomach, they're laying on their back. Thrust itself gets the term the pistol grip technique. It's going to look like you're holding a pistol. We create a well for the spinous processes to sit in, and then the transverse processes of the vertebrae we're going to perform the thrust technique on can sit on the knuckles here, and my thenar eminence on the other side. When the spinous processes are in that well like I created, my fingers actually point towards the opposite shoulder. You don't want to go in with your hand looking like you're shooting a gun straight ahead. Your hand won't line up and your spinous processes won't be in that well. So your hand should be in a position where it's almost like they're pointing at the two opposite shoulders, okay? You know, assess whatever, find the segment you want to work on. You're going to place your hand right in that position. And what you're going to do all at once is you're going to have the person take a deep breath in, let it out. As they let it out, you're going to roll them onto their back so they're over your hand. And at the right moment, you're going to push through the person's thorax and get the thrust that way. You can direct this treatment at the upper or lower thoracic spine. If you are going to work on like T1, 2, 3, or 4, what you're going to have the person do is clasp their hands behind their neck. If you're doing mid-thoracic down, you're going to have them cross their arms one over the other so their elbows are nice and tight to each other. Pillowcase, and I'm placing that in between the knuckles that I've created my grip for. That'll fill that gap. And then when I start to press now, it's not painful. Okay, so if I'm going to do an upper thoracic technique, I'm going to have the person clasp their hands behind their neck, try to bring the elbows slightly together. I'm going to identify the segment I want to thrust, get my hand in the position, and then when I have the person take a deep breath in and let it out, I am going to come over them, and then notice it's through their forearms. I start to extend him until he's right over where my hand is. Once I feel that, this could be a little more helpful as well. All the way out, quick, quick. Upper thoracic, sometimes what you can do to accentuate the amount of pressure through your hand is you can have the person simultaneously do a bridge. So when he bridges up, go ahead, feet together, he bridges up, you can see where now his upper thoracic spine is sitting right on the table and all that extra force going through that. You can try to do the thrust that way as well. I didn't really have much success with doing it. All right, my forearm is up against his forearms here, okay? when I bring him onto his back, okay, what I start to actually do is I almost start lower than my hand, and I start to come over the top till I just feel like I've taken up all that slack in the spine, and then I can push through, like through with your forearm using your body weight straight down to the ground. He rolls onto his back, and I'm over, my forearms are still over his forearms. Dealing with like a coastal vertebral dysfunction, right? And we want to do a thrust to that rib. You can do the pistol grip for the rib as well, okay? What you're just going to do is, instead of being over the spinous processes, you're just going to move your hand over, so your thenar eminence is basically right on that rib angle. Okay? Instead of finding a vertebrae, what I would do is I would just have my hand a little off-centered and just identifying that rib, and whatever rib that was, then I can take them over. And again, and in fact, what you do is, for me, I found you had to almost rotate them a little bit further than for the spine, because then you get that rib angle straight down, and then you can just do the exact same technique, except now you're just pushing through the rib instead of the spine. Top of your second metacarpal, you're going to engage the first rib. Your arm is going to be at your side, kind of tucked in, and the direction of force is inferior, anterior, and medial. And so what you typically aim for is the person's opposite ASIS is a great place to aim for. So what you're doing is you're just going to take up all that slack in the rib, aiming for the person's opposite ASIS, and then all at once what you're going to do, quick twist in motion. Person's head needs to be relaxed. If there's a lot of muscle tension on this side, or better on the first rib, you can side bend them slightly towards the rib you're going to thrust. That'll put like the levator, the scalenes, the upper trap on a little slack. This one, don't expect cavitation so much. Lets it out, I kind of take up the slack, and at the end I just give it the... And then immediately after, you take it back and you start to reassess the levator, the upper traps, the scalenes, because if they're in any type of tension or garden, this will help with that. People who use like scalenes as an accessory breather, let it out. So again, I'm going to want to put the side I'm doing the thrust on slack, so the arm comes into abduction. You can put your leg up and have them rest that on there. Side bent, and then my hand, you can just do the thrust through the, take a nice deep breath in and let it out. Rest that on the table instead, and then just with your hand here, take a deep breath in, let it out. Traction technique, using the person's body weight as the displacement force. I'm going to lock out his upper body, and then I'm going to have to try to pick him up off the table. Jim, what I need you to do is sit back so you're right on the back edge of the table on this side. What you're going to do is you're going to identify the segment that you want to try to direct that force at. Place like a towel roll right over where that is. On the side, you're going to kind of abut that. That's where we're going to try to direct the force, okay? It's the person to loosely clasp their hands behind their neck. And then as the therapist, I have to come in and under both sides. Pick your head up just a little bit. You okay? Okay. Are you all right? Yeah. Deep breath in. Let it out. Mid to lower thoracic spine, instead of the arm being behind the neck, it's going to be crossed over the chest. And into that. And then what you're going to do is you are simply going to come in from the sides. You are going to kind of pull on the elbows out like this, up from underneath, and start to almost like, see how I'm kind of curling him around? Let it out. So I kind of bring him back in towards me, and then let him up. Again, it's kind of a squeeze and roll. And then what I'm doing at the end of it, like see how I'm almost already vertical? All I have is just a little bit bend in my knees, and then I'm just straightening up my knees, right? I'm just, bam. And that's it, okay? And when I did his upper thoracic, I had him a little lower down, so he's not so high up on me, right? So I can be in a really good spot where I feel like I'm just standing myself up straight, and then I'm putting him right back down again.